This channel is not intended to diagnose or replace a doctor's advice. The content here is educational and entertaining. If you think you have a particular illness, feel free to talk directly with your doctor. Hello everyone, and welcome to our show. Today, we are going to talk about a disease that has marked the history of medicine and society, syphilis. This sexually transmitted infection caused by the bacterium Treponema pallidum has a fascinating and complex history. We will explore its origins, its evolution, its treatments, and its impact on society. Historical context. Syphilis appeared in Europe at the end of the 15th century, probably introduced by explorers coming from the New World. The first epidemics were devastating, with severe symptoms and high mortality. At that time, the disease was often called the French disease or the Neapolitan disease. Each country blamed its neighbors for the epidemic. There are several theories about the syphilis gene. The most popular is the Columbian hypothesis, which suggests that the disease was brought back from the Americas by Christopher Columbus's sailors. Other theories, such as the pre-Columbian hypothesis, claim that syphilis already existed in Europe before Columbus's voyages, but it was confused with other diseases like leprosy. The earliest treatments for syphilis were often ineffective and dangerous. Mercury was commonly used despite its toxic effects. In the 16th century, Gaia wood imported from the Americas was also popular. It was only at the beginning of the 20th century that more effective treatments were developed, notably salvarsan, an arsenic-based compound, and later penicillin, which remains the treatment of choice today. Syphilis had a profound impact on society, influencing culture, art, and politics. Fun fact, many famous artists and writers like Alphonse Daudet and Friedrich Nietzsche suffered from the disease. The stigma associated with syphilis also led to controversial public health policies, including compulsory screening and treatment programs. Today, syphilis remains a public health concern. Although effective treatments are available, the disease has not disappeared. Syphilis rates are increasing in many countries, partly due to decreased condom use and increased risky sexual behaviors. Prevention, regular screening, and prompt treatment are essential to control the spread of syphilis. Syphilis is mainly transmitted through direct sexual contact with an infected sore. Here are the main modes of transmission. Syphilis is transmitted during vaginal, anal, or oral intercourse with an infected person. Direct contact with sores on the genitals, mouth, throat, or anus is the main mode of transmission. An infected mother can transmit syphilis to her baby during pregnancy or childbirth, which can result in congenital syphilis. Or, less frequently, syphilis can be transmitted through direct contact with an active lesion on the lips, tongue, mouth, breasts, and genital organs. It is not transmitted through casual contact with objects touched by infected people. The first stage, the primary stage, is the most visual stage. Appearance of one or more painless cancers at the site where the bacteria entered the body, usually on the genitals, mouth, throat, or anus. Lymph nodes in the groin may be swollen. Chancres usually appear 3 weeks after infection and disappear spontaneously in 3 to 8 weeks, but the bacteria remain present in the body. The second stage, the secondary stage: skin rash, fever, headaches, fatigue, muscle aches, swelling of lymph nodes, patchy hair loss, and grayish-white lesions on mucous membranes. This stage can occur up to 6 months after the initial infection, and the symptoms may disappear without treatment, but the disease progresses. The third stage, the latent stage: absence of visible symptoms. Syphilis is still present in the body and can be detected by blood tests. This stage can last for years. Early latent syphilis, less than a year after infection, is still contagious. And the last stage, the tertiary stage. Tertiary syphilis or late syphilis is an advanced stage of syphilis that occurs years after the infection if it has not been treated. This stage can cause 3 different types of problems. Benign syphilis. After 3 to 10 years, painful lumps called gammas can appear on the skin, bones, or in certain organs of the body. These lumps can destroy tissues or leave scars. At about 10 to 25 years after infection, syphilis can attack the heart and blood vessels, causing chest pain or difficulty breathing. Neurosyphilis sets in after several years. This disease attacks the brain and the spinal cord directly. However, neurosyphilis is divided into 4 types. The first form of neurosyphilis is without visible symptoms. The person affected by this form of neurosyphilis does not show any apparent symptoms, even though the brain is still affected. The meningivascular form of neurosyphilis can cause headaches, memory loss, and even a stroke. Paralysis or dementia. This form of neurosyphilis causes memory loss, difficulty in thinking clearly, tremors, or seizures. Dorsal tapes. This form of neurosyphilis appears 20 or 30 years after infection, can cause very severe pain in the back and legs, problems walking, and a loss of sensation. Late syphilis can also affect the eyes and ears, vision problems, even blindness and hearing loss. Obviously, late or tertiary syphilis can also bring death. In children who contracted syphilis from their mother in utero before the age of 2, possible symptoms are skin rash and mucocutaneous lesions, fever, jaundice, anemia, swelling of the liver and spleen, runny or congested nose, inflammation of the bones and cartilage, brain and central nervous system involvement. And some infants may have a fulminant generalized infection that can be fatal without prompt treatment. Syphilis is an ancient disease with a rich and complex history. It reminds us of the importance of prevention and education regarding sexual health. Stay tuned for more fascinating stories about the diseases around us. See you soon. Come visit us, and don't forget to subscribe to the channel for other shows and bonuses. The channel Disease Maladie is a presentation of Lucidius Studios.